Hello, welcome back to part 8 of patient care. In today's video, we are going to talk about venipuncture and contrast media. So if you all can let me know in the comment box, have you all gotten to the point in your clinical setting where you have performed like venipuncture or blood draw on patients or even the mannequins? Just let me know in the comment box if this is something that you know how to do. For venipuncture, this is a medical procedure that involves inserting a needle into a vein to draw blood. You can use butterfly needles. These needles have those wings. As you can see, like on the picture, it has wings on it. That's why they're called butterfly needles. And then you have your intravenous IV catheters that is used for giving contrast media or medication. Also, you have hypodermic needles. This is used with a syringe to inject substances into the body or to remove fluid. So I have a picture for you to see which way is the bevel or where is the bevel, the cannula, and the barrel of the needle. A question that I always get is, do radiology technologists inject contrast media or draw blood? So you let me know in the comment box if you had this question before, but I will give you the answer. So yes, if you do work at an urgent care clinic, you may be required to draw blood, perform injections, perform drug screenings, and routine physical exams and take vital signs. So when I work at an urgent care clinic, one of my job duties consists of me pretty much performing as a medical assistant or like the nurse where I had to draw blood and then I also had to inject um they give you like a list of medications that falls under the doctor's license that you are able to inject into the patient. And for regular x-ray at a hospital, I haven't or I do not know anyone who has injected contrast in x-ray, but I know as far as being a radiology technologist, which that's what you have to start out as first if you're going for like CT, you do inject contrast for like CT if you are a CT tech. Okay, now we are going to talk about the steps in performing a venipuncture. Number one, the first step, you have to perform hand hygiene. This means washing your hands, using hand sanitizer. Sometimes whenever a patient is a hard stick and we have to call a radiology nurse, I always see them wash their hands. So you can wash your hands, you can use hand sanitizer. The second step is put on gloves. The third step is apply a tourniquet. The fourth step is find a vein. So you must find a vein by using like your fingers to like, let's see if I can show you, like feel for their vein. You can also feel for their vein on their hand, but you have to use a tourniquet first applied to the patient's arm. Like you will apply it like right here, or if you're going in the hand, you will apply it like right here on the wrist area. In order to have a vein pop up, you cannot find a vein without the tourniquet being applied. Some patients do have veins that poke out where you can see, but the ultimate goal is to use a tourniquet before starting an IV or drawing blood. And then you want to clean the site with an alcohol pad. Whenever you do clean the site, you want to start at the site that you're trying to go in, and then you want to clean outward in an outward motion. Push or prime the syringe with the contrast, saline, or medication before injecting it directly into the patient. So whenever you have your medication syringe or saline, you want to push up on the medication or saline just a little bit to get some of the air out of the syringe. This avoids air from becoming or being injected into the patient, which can cause problems for them. You want to insert the needle with the bevel facing upward, and you want to insert this at a 15 to 30-degree angle into the patient's skin. Remove the tourniquet. After you see blood, return it into the plastic tubing. That's step 8. For step 9, record the dose, needle type, and size, and side that you injected the medication in. Now we have our medication rights, which is very important. This is something that you all must remember, or you can be sued. But if you want to go over, or if you forgot what will make you get sued in radiology, you need to go back to my legal patient care video. I'm not sure if it's patient care 1 or patient care part 2, but I would try to remember to attach it to the end of this video so that you can just click on it. I will put the link to the playlist in the description box under my video so that you can find it quicker. So our medication rights are the right dose, the right patient, right medication, right time, right route, and right documentation. So all of these you must know before you even give patients any type of contrast, any type of medication. Okay, now we have a Q&A. I just want to test your knowledge. If you enjoy when I put the Q&As in the video, could you please give the video a thumbs up or comment below to let me know? Also, I'm almost done with the patient care videos and then I'll move on to the physics. I think this may be the last patient care that I would do, or I may jump to physics and then come back and finish one patient care video. But I'm thinking about making like a full video where I do like a patient care Q&A with all the questions and answers, like for you to study for your registry. So if this is something that you want me to make, could you please let me know in the comment box or give the video a thumbs up so that I can know to make those questions and answers for you? Okay, for the first question, how many degrees should the bevel of the needle be angled before inserting it into the patient's skin? Is it 5 to 10 degrees, 15 to 30 degrees, 20 to 35 degrees, or 30 to 40 degrees? I'll give you a few seconds and then I'll give you the answer. Okay, the correct answer is 15 to 30 degrees. That's how the bevel should be angled whenever you are getting ready to insert the needle into the patient's skin. Which step is required first before performing venipuncture on patients? Apply the tourniquet, clean the site, perform hand hygiene, or put on gloves. And I'll give you a few moments. All right, the correct answer is perform hand hygiene. You should always perform hand hygiene by washing your hands or using a hand sanitizer before performing venipunctures. This reduces the spread of infections. All right, now back to the questions or back to the lesson. For contrast media, you have your negative contrast agent, which is air. Air is the most common used agent. Air can be used with a positive contrast agent. And then you have your positive contrast agents. You have barium, the atomic number is 56. You have iodine, the atomic number is 53. So before you do inject any type of contrast, always ask the patient if they are allergic to contrast media or iodine, or even ask them to just tell them their allergies because they may not know the medical term or the medical name for iodine because it does have like other generic and brand names for it. So just let them give you their list of allergies and then you can see on their list what they are allergic to. For barium, barium is administered to patients as barium sulfate or an inert salt given for upper GI series or an esophagram, which is also known as your barium swallow. Barium can absorb water. Peritonitis can occur if barium sulfate escapes into the peritoneal cavity, which is why barium is not recommended immediately after abdominal surgery due to the risk of complications. So these are pictures that you can just use. You have your upper GI, you have your esophagram at the bottom, that's by me, and then you also have how the patient is normally positioned whenever they are getting ready for those barium studies. We have our iodinated contrast media. For ionic contrast agents, this is made of positively and negatively charged ions made of salts of organic iodine compounds. And then you have your non-ionic contrast agents, which does not ionize into separate positive or negative charges. So this is a good thing that it does not do this, and it does reduce the amount of contrast agent allergic reactions. This is very similar to ionic contrast agents. So always check your patient's allergy list before giving them iodine. Whenever I work in CT, that is something that we have to check before we inject iodine into their vein. And also whenever I am preparing another form of iodine, which is gastrographin, I make sure that the patient is not allergic to that. And also before I give them barium contrast to drink, I make sure that they are not allergic to it. We have our water-soluble contrast agents. Water-soluble contrast is used for gastrointestinal tract or your GI tract. Iodine-based come in liquid form. Water-soluble contrast agents are iodine-containing solutions, so it still contains iodine. It can be administered orally or rectally to enhance visualizing the GI tract. Positive contrast agents appear white and bright on the X-ray image, so keep that in mind. Positive appear white and bright. Negative is going to appear a darker color. Water-soluble contrast agents types are gastrographin. This does have like a bitter taste and must be diluted. And then you have your iohexol, also known as omnipaque. So that's why I was telling you that it's important for you to know different names that our contrast goes by, because a patient may not tell you that they are allergic to iodine, but they may say, I'm allergic to gastrographin. So you need to know what gastrographin is and what is included in the ingredients. Same thing goes for iohexol. They may say, I'm allergic to iohexol, but on their chart, it may say omnipaque. So that's why you need to know the generic and the trade name for these type of contrasts that we have to give. And the water soluble is also useful for your small bowel obstruction evaluation. Is useful for those gastrointestinal issues and suspected intestinal perforation. Before administering the contrast, always check that you have the correct patient, the correct date of birth. Check that the patient's creatinine range and bond levels and GFR is in the appropriate range. I will do a separate video with Q&A, and I will quiz you all on those ranges as well. Verify that the patient's weight and age with your dosage is correct. Review the patient's allergy chart and the history, and also tell the patient to drink plenty of water to flush the contrast out of their body within 24 to 48 hours. This can also prevent them from being constipated. So with the creatinine range, this is going to vary depending on what facility you work at. Some creatinine range, and it also changes with, with medical. Medical is always changing the numbers when research studies are coming out. You even see that there are changes now with the lead apron shield. So for the creatinine range, that's going to be about 0.5 to 1.5 or 0.6 to 1.7, depending on where you work at. For your GFR, in radiology, anything below 40, you must consult with the radiologist to see if you can give them contrast because of their kidney function. And then you also have your burn ranges going to range anywhere between 7 to 15 or 7 to 20, depending on the facility that you work for. Now we do have the side effects. For contrast, you have your sneezing, nausea and vomiting, itching, coughing, your hives, also known as urticaria, hoarseness or change in voice, sensation of heat, cardiac arrest, shortness of breath or dyspnea, loss of consciousness, and paralysis. So whenever we do give patients contrast, because I work in different modalities, I work in CT as well. We do have to give them iodine and inject it into their vein, and this will make the patient feel warm. So that's going to be a known side effect, that it will make them feel warm whenever the contrast is going in. Patient care after giving contrast, especially if the patient does have a side effect, you must monitor your patients, document the type of contrast that was given, also the type of side effect that they did have, call the nurse or the doctor. You may need to check with your policy to see who should be called first. I know at my job, they want you to call a code blue for the code team to come to access the patient. Your facility may want you to call a radiology nurse first. So just go by your policy on who should be called first. Always remain with your patient. Do not leave them. If you need to step away, call someone to come and stand or be with the patient if you do have to step away for a moment. Monitor your patient's vital signs if needed. If you are told that you are in charge of monitoring the vital signs, I know at outpatient imaging clinic where there may not be a nurse, you may have to be the one to monitor the vital signs for the radiologist. But at a hospital, of course, the nurses or the doctors will do this. All right, that's it for this video. If you could please give it a thumbs up. If you would like a part 9, which will, if I do a part 9, that will be or should be the last of the patient care video. Also, let me know in the comment box if you would like for me to do a full Q&A video, just quizzing you all on the patient care videos that we've been watching and going over. I think up until I made this video, I think I only have maybe 5 or 10 people on my channel that is watching for just x-ray. So I thank you all for watching. Thank you all for commenting, supporting, giving the video a thumbs up. I know probably in a few months or a year or two there will probably be more students watching these series, but as of now I think I only have maybe 5 or 10 of you all watching. And if there is more watching, just let me know in the comment box. But other than that, thank you all for watching. And just let me know if you want me to do practice test questions and answers for patient care for you. All right, thank you so much. Bye.